Hi, my name is Amelia, and today I will be discussing bipolar disorder and its relation to deaf patients. A while back, there was a study done for deaf patients who went to the University of Cincinnati Hospital during the years of 1983 to 1999. 28 patients were included in this study. 11 out of the 28 patients were diagnosed with bipolar disorder. After the study ended, a new person came to review the study. He reviewed the same 28 patients. The new person had no idea of their previous diagnosis. He interviewed them using the same interpreter for everyone. All 28 deaf patients were pre-lingually deaf. Backtrack, 2 patients became deaf later in life. Their diagnosis is not included. Moving on. For patient diagnosis, 11 were diagnosed with bipolar disorder. 11 were diagnosed with major depressive disorder. 2 were diagnosed with schizophrenia. 1 patient was diagnosed with schizoaffective disorder, intermittent explosive disorder, substance-induced mood disorder, and dementia brought on by HIV. Twelve of the 28 patients had substance-related comorbid disorders. Patient deafness. From the 11 patients that were diagnosed with bipolar disorder, 8 of them were men. From those 8, 5 had congenital deafness. 3 of them were deaf from head trauma or infection prelingually. These 11 diagnosed with bipolar disorder previously had very different diagnoses from each other. This study and the review of this study prove deaf patients often are misdiagnosed. This can happen because of unskilled interpreters, cultural bias based on how deaf people express themselves, linguistic bias from a language deficiency or delay. This is important to use CDIs. CDIs can help bridge the language levels. Currently, 75% of deaf people in mental institutions experience language deficiency or delay. What are a few noticeable signs of deaf people who have bipolar disorder? A change in their signing behavior, such as rapid signing or incomplete thoughts being signed, but this information comes from hearing people. Again, it's important to use CDIs for help.